Thank you for coming. We have just finished our first of the year meeting of all concerned to prepare for hurricane season, which started June 1st and goes through November the 30th. That's 6 months. As of today, there are no hurricanes in the Atlantic, but that could change by this afternoon. But we are well prepared and well experienced. In our meeting that we had just a couple of hours ago, we were in the room there assembled with others from the counties, the coastal counties, on the phone with us, going over the things that we want to accomplish, the pitfalls, the dangers, and improvements we've made that we make every year during this time. So to describe those and answer the questions, we have everyone assembled here. But the message I'd like to give to the citizens is first, don't wait until a hurricane's coming to find out what you're supposed to do. This is an excellent booklet. It is prepared by the Emergency Management Division, Director Kim Stinson, who could answer questions about it. But it has maps. It says to know where your zones are, know what you're supposed to do, know where the exit routes are, and primarily follow the instructions and listen to the instructions of those officials involved rather than social media, and be very careful and know about it in advance so that they were not caught off guard. We want everyone to be prepared and everyone to be able to act as their own emergency management professional. So with that, I'll call in these in succession, starting with Director Robert Woods.
Thank you, Governor. Good morning. I'm Robert Woods. I'm the Director of the South Carolina Department of Public Safety. The Department of Public Safety, working with its partner, South Carolina Department of Transportation, began our preparation efforts for the upcoming hurricane season in January, as we physically checked every route, every evacuation route in the state, ensuring that the proper signage was in place, and also confirming that we had adequate traffic control point staffing. We followed that up by meetings with both our state and local partners in each of the hurricane regions, the northern around Myrtle Beach, to the central from Charleston, to the southern in Beaufort, to make sure that the plans were clearly understood by our supporting agencies and that all the necessary resources, all the necessary personnel were properly committed to the mission. We will finish our preparation efforts with our full-scale exercise, which will be on June 17th, which we will, working with DOT and our other state partners, test our reversal plans for each one of the hurricane regions. One of our points of emphasis consistently over the years has been this: understand that the evacuation plan and the success of the evacuation plan is based on each individual citizen knowing what their evacuation route is and taking that evacuation route. We need to be able to disperse all that traffic throughout the evacuation network in order to effectively keep that traffic moving. So that's a tremendous point of emphasis for us. So to conclude, I'll say this: as we finish our preparation efforts, we ask all South Carolinians to begin their preparation efforts. Make sure that you know your route. There's a number of resources that are available that define what evacuation zone you're in and what evacuation route you'll need to take, along with other great advice on other preparatory actions you need to make prior to evacuation. So please take advantage of those resources. I know Director Stinson will outline a number of those. With that, I'll turn it over to Secretary Hall from the Department of Transportation.
Secretary Hall.
Thank you, Director Woods and Governor McMaster. The South Carolina Department of Transportation has close to 4,000 employees that are ready to respond, react, and recover our state's infrastructure from any pending natural disaster that may come our way. With regards to the hurricane season here, as Director Woods mentioned, we are preparing for a full-scale statewide exercise coming up here shortly to make sure that we're all ready and synced up with regards to our operational procedures with the reversals. In particular, we will be looking at the I-26, the new and improved I-26 reversal plan that we implemented and developed in 2020. As you may know, or as you may recall, that reversal was simplified by, first of all, shortening it by 25 miles, bringing it up I-26 from the 526 interchange more to where it actually starts at the Nexton Parkway interchange in the Somerville area instead of the 526 area, basically to ensure that the Charleston region can continue to navigate as it traditionally would prior to a reversal. So the new reversal, 25 miles shorter, starting at the Nexton Parkway. The reversal will be very easy to navigate as you travel up 26 heading towards the Columbia area. It'll appear that I-26 forks, and you can either take the left fork or the right fork, and you will essentially either stay on traditional 26 heading up towards Columbia or travel over a crossover to the reverse sides of 26. In addition to shortening and improving that entry point, that main entry point into the reversal, we've added 2 additional entry points along the way so that it will add convenience for the motorists as they travel up the reversal side to be able to regain entry into the reverse sides of the lane. With that, we stand ready to implement and do whatever we need to do to ensure rapid response and recovery to any storm event. And with that, turn it back to the governor.
General McCarty.
Thank you, Governor. On behalf of all the employees of the Military Department of South Carolina, and certainly to our soldiers and airmen that are our primary responders to an emergency such as a hurricane, just want to assure the citizens of the great state of South Carolina that we are prepared for a hurricane or other events this year. We, on a continuing basis, look at our performance on past events. We review to determine where there may be issues or concerns that we need to address. We have done that. We're also have assessed our personnel this year. Between our Army and Air, we have a little over 12,000 soldiers and airmen in those 2 organizations. We do have both Army and Air National Guardsmen currently deployed. However, we have ample resources to be able to cover our missions as identified by the state all hazards plan. We've been in contact with the state and federal agencies that we work with. We've reviewed their plans and we support their plans, and we're confident that we're in a position to be able to fulfill our needs there. In the past, and I would anticipate possibly if we have a storm this year, we may have to, as we look to address any shortages that we may have in certain type of units, our military police, our engineers and aviation assets, we will reach out to other states that have that. That's through the Emergency Management Assistance Compact. We've already made that initial contact and coordination there. I feel confident that those resources would be available if we were to need those. In addition, we have a rehearsal scheduled for next Saturday to pull in all the players and to ensure our plan is synced and we're ready to execute. Thank you.
Thank you, General. Director Michael Leach.
Thank you, Governor. DSS is charged with being the lead state agency for mass care of our citizens during emergencies. This means on top of our day-to-day operations of helping children, adults, and vulnerable populations, we work alongside our county emergency management and coordinate with volunteer agencies such as the American Red Cross, Salvation Army, and many others to provide sheltering, feeding, and distribution of goods and services to affected South Carolina populations. We will be utilizing the latest CDC, DHEC, and American Red Cross guidance and procedures for safety precautions for mixed population environments. There'll be COVID screening that will occur prior to individuals entering the shelter and multiple times daily, as well as if someone leaves and returns to the shelter. All hurricane evacuation shelters have pre-staged PPE on hand and extra hand sanitizing efforts for staff and citizens. And thanks to our partners at DHEC, we've added capability to have COVID testing and vaccinations should our citizens request either while staying in a South Carolina Red Cross managed shelter. No one should worry about what shelter they go to if they have a pet. Through our partnership with Clemson University Livestock Poultry Health, we'll make sure that everyone with a pet, no matter what kind, is taken care of and does not need to worry about them and where to go to weather a storm. Due to shelter capacity, some pets may be sheltered in another location, like a local veterinarian's office, but rest assured all pets will be accommodated to the best of our abilities. Couple reminders, whenever citizens can do to help their pet, bring crates or carriers for their pet's comfort, photos of the owner and their pet in case of separation. Any documents and medical records will greatly help in safeguarding their pet. And for our citizens, making sure if they have to go to a shelter, bringing prescription medications, extra clothing, pillows, blankets, hygiene supplies, other comfort items, important documents, and anything needed for children, diapers, formula, toys, and any items needed for family members with unique needs. Thank you.
Thank you. Director Ed Simmer, Department of Health and Environmental Control.
Thank you, Governor. Good morning, everyone. I'm Ed Simmer, the Director of the South Carolina Department of Health and Environmental Control. Good to be with you. We've been working on planning for the next hurricane ever since last fall, when we were very fortunate to have a season without any significant hurricanes. We're not assuming that for this year, and we are doing everything we can to make sure the people of South Carolina are ready in case we do have a severe hurricane this year. Very fortunate to be able to work with the agency directors who are here today and their teams, and certainly the governor and his staff. We are coordinating and collaborating very closely with them to make sure that the state is ready. 3 areas in particular that we are focused on. First is medical needs shelters. These are shelters for people who have medical needs, such as, for example, a piece of medical equipment that needs a guaranteed power supply. Perhaps they have medicine that needs cold storage. And so if they went to a regular shelter and that shelter lost power, they would have a problem. So we have specific medical needs shelters that have a guaranteed power supply so they can be taken care of. We've also recently partnered with some inpatient hospice facilities. We're very fortunate to have them as partners now. That will increase the number of medical needs shelters we're able to open coming this hurricane season. We would certainly ask citizens not just to come to one of these facilities. Please call our number or otherwise reach out, and we will screen them, determine if they do need that medical needs shelter, and we can then help them arrange transportation to get to that location. A second area we're very focused on is rapid response after a storm passes. There's a lot of different things that can happen after a storm that pose both health and environmental risks. We have ready response teams that are ready to go out on a moment's notice as soon as the risk is passed, working collaboratively with our local emergency managers and local governments to make sure that if there's a dam, for example, that's at risk of breaching, or a sewage facility that has been inundated, or a hospital that's had damage, that we can go out and help them assess the risk and help develop a mitigation plan as quickly as possible. Finally, we're also working with our healthcare facilities across the state to make sure that we are set that we can move patients quickly if we need to evacuate patients from a hospital or other type of healthcare facility in front of the storm, and that we get those facilities up and running as quickly as possible after the threat has passed to ensure that individuals have medical care available, especially emergency and urgent care, if they need it. From the standpoint of what we would ask citizens to do, number one, very importantly, is if you've not been vaccinated against COVID-19, please get vaccinated before the storm comes. That's very important. If you're in a shelter with lots of folks and you're vaccinated, you're relatively safe. That's why we don't have to wear masks today, because we've been vaccinated. But if you're in that shelter and you're not vaccinated, your risk is much higher. So please get vaccinated. That's a very important part of hurricane preparation this year. The second thing is if you're in an evacuation zone, please evacuate. Don't wait, get out. There are lots of different threats to your health after a hurricane. Floodwaters can have a lot of different toxic substances. There's different types of infections that you can catch from floodwaters, from mosquitoes, other things immediately after the storm. And as we said, we may or may not be able to get you medical care immediately after that storm. So if a tree falls on you, you're trying to do some work and you get injured, we may not be able to get you the medical care that you need as quickly as we would like. So get your COVID vaccine, evacuate when the order is given, and it'll make things go much better for everyone. With that, sir, I'll turn it back to you.
Thank you, sir. Thank you, Doctor. Director Kim Stinson, Emergency Management Division.
Thank you, sir. Yeah, Kim Stinson, State EMD. Couple of points. One is one of our biggest strengths here in South Carolina is the outstanding team that has been assembled over the last several years that has trained together, planned together, exercised together, and operated together. We've had 10 major disasters in the last 8 years, and having that experience places us in an excellent operational posture should a hurricane hit South Carolina sometime this year. From 2015 to 2019, we've seen significant damage from hurricanes, either from direct landfalls or glancing blows, and pretty significant inland flooding. It's very important to note that hurricanes are not strictly a coastal event, but they can strike far inland, and it's really a South Carolina event. You can end up having hurricane force winds all the way up to the North Carolina border, which is very significant. So it's not just a coastal event. As we refine our plans to make them more efficient, it's a good idea for people at home to do the same. And this year, we've launched a new website for people to use as a quick reference tool to begin their hurricane planning. And the new site, it's hurricane.sc, hurricane.sc. It's highly interactive and adaptive and much easier to use than a digital version of the hurricane guide, which the governor had pointed out earlier. These are this year by NOAA. And in times of emergency, timing is extremely important, and having this guide at your fingertips all the time will be very important. It'll help everybody make informed decisions about their personal safety. Again, that's hurricane.sc. It should be fairly easy to remember, and that's why it was designed that way. This new site is a companion to our existing site, scemd.org, and also our South Carolina Emergency Manager mobile application. But they will continue to serve as hubs for information in real time when we actually have disasters. The printed guide has been distributed through newspapers from the coast back to Columbia. It's available in English and Spanish. It's also available at Walgreens statewide, at coastal DMVs, at welcome centers along the interstate, and also download at scemd.org and at hurricane.sc. So, in summary, we need to encourage all our citizens to get prepared, and these tools will help them. And as the governor said, it'll help them become their own personal emergency manager. Thank you.
Thank you. And I would like to remind those, as was Director Stinson mentioned, this is not just a coastal situation. In 1989, Hurricane Hugo came from the coast, blasted through Columbia and knocked down big trees in Charlotte, downtown Charlotte. So we need to be prepared. And again, on the government side, the state and local, our agencies are prepared and preparing more every day, and we'll be practicing continually. But we would urge all citizens, everyone ought to have one of these, either have one of these brochures or go online and take a look. I'd like to see one of these at least in every, particularly vacation homes and hotels and things along the coast especially, because there's a lot of interesting things in here that ordinarily you wouldn't even think about. And once you read it, you've got it and you can protect yourself, your loved ones. So I'd ask everyone to, like the Boy Scouts and the Girl Scouts, be prepared. And number two, listen to the authorities for sources of information and not gossip in what may appear in social media, because a lot of time and effort has gone into figuring out the type of precision and coordination necessary to keep people out of harm's way or to get them out of harm's way. And everyone needs to take advantage of the intellectual effort that went into and practical effort that went into getting this done. With that, are there any questions? There you go.
Has been saying that everyone needs to get their vaccine as part of their preparedness plan. Is there anything you'd like to say to the significant portion of South Carolinians who haven't gotten their vaccine yet?
Well, it's available just about everywhere. I know there are over 1,000, I presume, over 1,000 locations and there's plenty of vaccine available. All it takes is now would be a good time, if you want one, now's a good time to do that. Would you like to elaborate?
Yeah, we have lots of vaccine available, locations you can get the vaccine all over the state. Certainly, we understand people have questions, may have concerns about the vaccine. We certainly encourage them to get those questions answered. It's very appropriate that they have questions. But go to reliable sources like cdc.gov, like scdhec.gov, our website. Lots of information about the vaccine. Call our number. We will get you the answers you need to help allay any concerns you have about the vaccine. But it's very safe. It's very effective. It's been given to over 100 million people in the United States with very few significant adverse effects. So there's no good reason not to get it, but lots of good reasons to get it. Thank you.
Over here.
Director Leach, can Can you expand upon vaccinations within shelters, how will that work, what brand will be available?
Yeah, I will also, Director Simmer might be able to assist with that. But yes, on the front end, we want to make sure that, folks are tested and that vaccinations are available, potentially post-storm will probably be when that would probably occur. If there are concerns as far as, health and if somebody is saying that, hey, I'm feeling bad, that we will have the opportunity within the shelters for isolation and making sure that there's ongoing testing with that. Do you have any?
As much as we can, we plan to use the Janssen vaccine. I'm sorry, yes, I can, sorry. As much as we possibly can, we're planning to use the Janssen vaccine in the shelters because that way people don't have to come back, which, immediately after a storm may be hard. So as much as we can, we're going to use the single-dose Janssen vaccine in the shelters immediately after the storm has passed.
Director Leach, can you talk a little bit more about the pet preparation? That's a major barrier for some folks not wanting to evacuate. Do you have advice for folks to maybe get their animals microchipped ahead of time? And also, if their animals are in a separate location, is there going to be a way for them to, know exactly where that pet is and monitor them?
Yeah, yes, so that's a great suggestion as far as the microchip. But yes, we have been working on this at Dorian, for example. When people, we had shelters where people were able to bring their pets, as well as making sure that we're putting the pets in local veterinary offices and make connection with the citizens, for sure. Just make sure you have everything ready for your pets, is really important. And for, our citizens, I mean, you just have to, you really need to think through and be prepared what you need to bring if you have to go to a shelter when that's ready. So again, medications and clothing and pillows and blankets and documents and things that are really important to you need to be brought as well.
And I would imagine that would include making sure that your animals have their vaccinations up to date, should they need to be put in a facility like a veterinary.
That would be very helpful, yes.
Thank you.
Okay, next. Yes, sir.
Any emphasis you guys want to put on use of generators during storms? I heard a statistic, I think it was out of Florida recently, that there was more deaths due to carbon monoxide than there was from storm surge during this time.
Yes, and unfortunately, that's always a problem, and we've actually had deaths here in South Carolina for that. But certainly, if you're going to use a generator, put it in a well-ventilated area outside of the home, and obviously, do the safety checks on that. But unfortunately, in many cases, people take the generators, they move them in their garage or inside the house somewhere, and it just adds up to just terrible effects there. So we would definitely emphasize, if you want to use a generator, make sure that you use it safely.
Is that an issue that we've seen a lot of here in South Carolina, would you say?
Not a lot, but we've had several fatalities over the last several years. And it happens, unfortunately, other than hurricane situations. Anytime the power goes out, it happens. Sometimes in the winter storms, that sort of thing. So it's definitely something to be very careful of and make sure that you use those generators safely.
Kim might want to mention back the electricity into the lines when the power companies are working on the lines, if you hook it to your house.
Oh, yeah, there's also, again, it all goes back to the safety piece of it, is to, if your electricity goes out and you hook up the generator improperly, when the electricity goes back on, then, you may have a problem there as well. And a lot of these full house generators right now, they have transfer switches on there that take care of that, but on the average generator, that probably doesn't have that capability.
When's the full-scale rehearsal?
Full-scale exercise is on June 17th.
June 17th. What should people expect to see when that happens?
They'll just see a larger presence of Highway Patrol and DOT in particular along I-26 in the Midlands, US 501 in Horry County, and US 278 and US 21 down in Beaufort. So lanes will not actually be reversed. There will be a press release that we'll do ahead of that jointly with DOT to make sure that folks are aware of that in a timely fashion. But you will see a larger presence of both DOT and Highway Patrol at the roadside. Secretary, anything to add?
One other thing about carbon monoxide poisoning people need to know. There's no warning. You can't smell it, you can't see it. Basically, it just makes you tired, you go to sleep, and you never wake up. So there's no way to know that you're getting carbon monoxide poisoning, which is why people have to be so careful with that. The other challenge is carbon monoxide poisoning is not easy to treat once you have it, and immediately after the storm, getting effective treatment for carbon monoxide poisoning may be very challenging. That's why people have to be so careful. Keep those generators outside, and anything that's burning fuel outside of their homes, and make sure that that carbon monoxide is not being pulled into their home where it could kill them or their family. Thank you.
Governor, can you talk about utility preparation? I know there's nobody here from Dominion or anything like that, but I'm assuming you've been in touch with them. And can you maybe talk about the preparation on the ground from power
Yes.
companies and utilities?
Yeah, that's an ongoing coordination. The Office of Regulatory Staff coordinates very regularly with all the power providers. When we actually have an event, we'll have at least some of the power provider representatives here in the SEOC, the State Emergency Operations Center, to effect coordination there. But they've got some very extensive plans that they have put together to help themselves and help each other. And you've often seen that, you know, when we have an event here in South Carolina, that you'll have utilities come from other states in huge convoys to come down. So they've got their own plans, and they've also got their own, basically, emergency management complex to back each other up. So again, that's an ongoing operation.
More questions?